Welcome to Mama Toto Docs.
I'm Dr. Martha, the pediatrician.
And I'm Dr. Lisa, the obstetrician.
And today we are going to be discussing about infertility. We recently commemorated the World IVF Day, the 25th of July, and we thought it would be an interesting topic to discuss about infertility. So, Lisa, can you demystify what infertility
is? So firstly, the definition of infertility, basically it's when people are struggling to conceive. And if you're below the age of 40, that can take up to a year. So for a year, for people struggling to conceive, then we consider it infertility or subfertility. Some people think, they've been trying to get pregnant for 3 months, 2 months, and nothing has happened. That is not infertility at all, especially if you are under the age of 40. So research has shown that some people, 1 year of trying to get pregnant is perfectly normal. So even if you haven't after a year, it's fine. And even going into the second year, half of the couples that have been struggling to conceive end up conceiving after 1.5 years. So it's perfectly normal in the background of people who are completely fine, don't have other issues, don't have any, hormonal imbalance or any other diseases that would prevent them from conceiving. So that's the definition. When we look at it, we look at male infertility and also female infertility. A lot of the time, and what we see, especially in our setting, is that women tend to be the ones who, carry the whole, the brunt of fertility or the baggage, the stigma of fertility on them, not knowing that men contribute 40% to fertility issues. So it's so important, firstly, that whenever you're seeking help about infertility, that you go with your partner so that both of you can be asked questions and to figure it out. So that is basically infertility. And then now when we look at the risk factors of infertility, we see that there are many different ones: environmental, there are social, and then there are also medical as well. So those are things we need to keep in mind. So firstly, when people are obese, both men and women, then their fertility chances are a bit lower than the rest of the population because that has an impact on their hormones. So it's very important now, in the face of that, if someone is obese or overweight, that they work on trying to lose that weight. Healthy diets, healthy lifestyles goes a very long way in helping with fertility. And then when we look at other social things like drinking alcohol actually has an impact on fertility, both for men and women. So for women, the advice is generally to maybe have a few units of alcohol a week if they're trying to get pregnant. So maybe 2 units, which is like 2 glasses of wine or 2 beers and so on. And then now for men, also alcohol has been seen to affect the sperm quality as well. So they're also advised to reduce the amount, basically not to go binge drinking and so on. So alcohol is one thing. And then when we look at smoking has a very big impact on infertility for women and also for men. And it's not just, active smoking, but also passive smoking can have an effect. So for both, smoking can reduce the sperm quality for men, and then for women, it can just affect the ability to conceive. Both active and passive as well.
You had also talked about age.
Yes.
So you said if they are over 40?
Yes. So over 40, just the chances of conception are lower and lower, just because the quality of the eggs is not the way it used to be before. So then that just means that there's more difficulty in conceiving. That's not to be said for men. That's mainly for women, to be honest.
And the duration of trying when they're under 40 is trying for more than a year?
It's trying for a year. So regular trying for a year. And another myth or another thing that I've seen commonly is that people only try when they believe that they're ovulating. That's the time that they try. But the advice is generally to have sex 2 to 3 times, 2 to 3 times in a week. So let's say every other day, regardless of whether someone is ovulating or not. Just going on, because you can never quite time when you're ovulating. So that's the advice. So it's regular sexual intercourse, not on contraception, for at least a year. And then after the year, if you find there's nothing much happening, and this is for people who have no other illnesses. When I'm talking about illnesses, I'm talking about thyroid issues, if there's any, hormonal imbalance or anything else or autoimmune disease, if everyone is perfectly okay as far as they know, then a year is fine to try without any stress and anxiety. Because also stress can affect when someone ovulates, when their period comes, stress, anxiety, and all of that still has an effect. Yeah, so that's the general advice.
And you said some of the things couples can do if they feel like maybe they may be having this problem is they should both present themselves to their doctor.
Yes.
And have like a full checkup.
Yes.
What are some of the treatment options available?
Okay, so the treatment options depend on what is found in the test. Because the woman will be checked, she'll be checked if there's something structural, which means if there's something happening in or around her uterus, like, severe endometriosis or very, very, large fibroids that are affecting the cavity and so on. And if those are the things, then that can be sorted out surgically for the woman, and then she can then conceive. For men, we do semen analysis just to look at the quality of the semen. Sometimes if they have low sperm count or anything like that, you also do ultrasounds and just check and see if there's something that might be blocking the flow and so on. So those are first of the tests, and then the treatment now depends on what's going on with them. But if all else fails, then there's the option of IVF. So IVF is basically in vitro fertilization, where an egg is taken from the lady and the sperm is taken from the man, and it is basically put together, and then after some time it is put back into the woman now to grow. Various tests are done, but IVF is very common. But there's also something known as in uterine insemination, where basically the sperm is taken from the man and injected directly into the woman's uterus, just to help things and the other different things. So with IVF, usually the body is stimulated with hormones, so you're injected with hormones and so on, just to help ovulation and to make sure everything is optimum. Then the egg is taken, fertilized, and put back in. So those are some of the treatment options, but the most important thing is after a year of regularly trying without any stress, it's stressful because people will be like month after month, the period is coming and it keeps reminding them that they haven't been able to conceive. But to know that first, it's totally normal. For a year, nothing has happened, but it's regular sex, it's actually totally normal. And there are high chances of you conceiving even within the next year. But after that year, someone can go with your partner, go and both of you be analyzed, asked questions, and so on. See what you need to modify. If it's lifestyle, if it's diet, that needs to happen first. Then all those tests can be done, of which there are very many. Very many, which we won't get into. And then now further treatment. So for people when they're going to visit, yes, it's good to start with a normal obstetrician gynecologist. But for further management, there are so many fertility specialists around who are also obstetrician gynecologists, but who are subspecialized in fertility. So most of the time, you'll find your obstetrician refers you to them, or you could just go straight to them.
Okay.
Yeah.
Thank you, Lisa.
Okay.
I hope you've learned something about infertility. If you have any questions or feedback, let us know.
Yes.
We'll see you next time in our next video, and subscribe. Bye.
Bye.